you're a local guy,
Yeah.
and you grew up around here. A lot of people know you, but a lot of people are new to the area also who wouldn't know you. So I just wanted to see if first, tell me when you started here as the administrator, and what was your journey up the ladder of success to reaching this point here.
All right. So I started here as the administrator in December of 2023. Regina retired. Our administrator previously. Regina, she was an excellent resource. I worked with her probably about 7 or 8 years probably here in different roles. So I started here as a PCT, patient care tech in the ER. That was when I was in college. And so once I graduated, I went to I was in nursing school. And when I graduated, I worked here PRN in the ER as a nurse, and then I moved up to Holston Valley for a little while and still stayed and still worked here some. I worked there in the ER at Holston Valley. And then I come back, I wanted to come back here. Hawkins is always, of course I was born and raised here, it's held a special spot to me. So I come back to Hawkins and worked full time as our ER and ICU float nurse. And then then our ER manager decided she was gonna transfer for a different position, and it kind of come up as, hey, is that something you might be interested in? So never seen myself doing that, but that's something that I thought, well, maybe I'd give it a shot. And
so that was your first step into the management role.
Management was as the ER manager here at Hawkins.
Yeah.
So I had the ER and ICU. I was the manager of both.
I bet that was an exciting time being there.
Yeah. So that was in 2018 probably.
Okay.
And then things happened, and our CNO, she retired. Virginia Jeffers was our CNO prior.
Okay.
She'd shoot me if I...
Regina Jeffers?
No, Virginia Jeffers.
Oh, Virginia Jeffers.
She'd shoot me, or Diane Virginia Jeffers, but Diane, you can refer to her as Diane if you write the story.
Okay,
so.
Diane.
She'd shoot me if I forgot her name. She'd tell me that.
Tell her you're under pressure. You're under stress.
Yeah, that's right. No, but Jeffers was great. She worked here for a long time in the system too, and they all took me under their wing and really taught me a lot. And you know, once I took that CNO role in 2020, so my first week as actually the CNO and assistant administrator as a combination job was when we had one of the first COVID outbreaks, and our staff was the first ones in Ballard to have it. So we had several staff members out. We made the news and things. Wow. So I hit the ground running as a CNO, and there was a fiasco of events after that. So
is that what they call baptism by fire?
Yeah, that's about it. Yeah.
Okay.
Yeah. So, but it was great, and you know, like I said, Regina was a great mentor through that.
And what was Regina's last name?
Regina Day, and she was our administrator here for. And you know, I worked hand in hand with her through the whole COVID era, I'll call it. And that was a trying time, and like you said, death by fire. Honestly, that was one of the toughest times for the whole facility and for healthcare in general. I mean, it was a challenge, and I do think that I learned a lot. It was tough. There was many nights that we didn't know what was going to happen, and we made it through. Did what we had to do. So, but yeah. So as far as me and growing up here, like I said, Hawkins holds a special place to me. Actually, one of my great aunts was the director of nursing here at one point in time, many years ago.
What's her name?
Barbara Freaky.
Okay.
And
how do you spell her name?
Frickie.
Okay.
Yeah. So you know, my family's grew up in healthcare. My mother's a NICU nurse. My brother's an ER nurse at Johnson City Med Center, and my sister's also a nurse. She's worked with us before in the system.
Okay.
And then my wife too is a OB nurse in the system. So,
oh boy. Okay.
So we're all in the healthcare realm and committed to taking care of patients. It's what we do. And you know, growing up here, even more, the people of the community know me, and I want to make them proud. So.
Right.
Many know me. I mean, you know me probably from writing high school football stories back in the day. But good or bad, depend on the weekend.
Yeah. Well, I was going to say, were you involved with Cherokee's nursing program also?
I wasn't. That was before. That was before that was created.
Oh, okay.
So, but we are involved with the HOSA class over there quite a bit. Amy Jeffers used to work for us here, but she's full-time there, and we have a good relationship with her, and we work with that HOSA team here locally to get them involved, and they've actually been here some this week, and they'll be here next week too.
Well,
so
when did you know you wanted to get involved in healthcare as a profession?
well, so Mom, it's kind of all I knew with Mom being a NICU nurse.
Yeah.
And then I don't know. I thought I wanted to be a doctor, so I started my journey at LMU in pre-med, and then I don't know. At some point through there, I thought, well, maybe I want to go to nursing school because I was working here in the ER, like I said, as a tech, and so I was interested in ER, and then I kind of thought, well, ER nursing might be something I want to do. So I did work some trauma at Holston Valley, and I loved doing that too. And so that kind of got me. That Mom probably influenced me more to start on the medical side of things, but I took a different route than I ever thought I would, though. So
that's going to say, when you began this your career, did you see yourself in administration, especially as the whole hospital administrator?
Right. No, I did not, and that's a testament to just sometimes you don't know what you want to do when you grow up. I still don't know what I want to do when I grow up, but I think that's all of us. So the sky's the limit. You never know what you may end up in. I never seen myself sitting in this seat, and I don't look at myself any different than anybody that works here either. I think it's important that you have a good relationship with your team members. That's been shown throughout the whole COVID fiasco of our team stayed together. We didn't have travel nurses here, and I serve Hancock County as well. And we didn't there either. Our team stayed together. They were committed and took care of our patients, and we've held together and as a family. These two hospitals are like family, and so that's a lot to be said about the people that work here and how things panned out across the nation with COVID, and travel nursing became so important to many areas, but we were able to hold on to our teams here, and that when you talk to our team here, they'll tell you our patients are number one, and we love them, and we're here to serve them. So and you'll find that across the board.
When I started covering Hawkins County in '98, Mr. Testerman was the administrator.
Oh yeah,
and he had been here forever, and but he was the local homegrown guy. Yep. And so I think that you're the next homegrown guy to be the administrator after he retired. I guess it's over a decade ago.
Yeah. So and he held on to our board for quite some time until he passed away. Yeah.
So being the next homegrown administrator, do you see this as a long-term thing? I do. Like a career for like.
Yep. I do. I enjoy what I do. That's one thing I'll say. I don't dread coming to work every day. It's not a job to me. It's more of it's my service to the community and what I feel like that I should do. So, do
you see yourself 20 years from now still as the administrator?
I'd be happy if I was. So
yeah.
I wouldn't complain.
Yeah. Okay. Well, so I guess another thing I wanted to talk about was this is my hospital. Even though I live in Kingsport, I work in Rogersville, so it's easier for me just to come here or the clinic next door. So I'd be curious to know, what is the vision for the future? The services that are provided here now, are they going to stay, and is anything else going to be added? Things like that.
Yeah. So Ballot's committed to our rural facilities for sure.
Yeah.
And across the nation, you see the many are closing down and have struggled through the times of healthcare today. And that's one thing system-wide we've built a few new facilities in the last few years, and there's really a focus on the community facilities and keeping them going and keeping access to our patients. So we want to continue to do that. Ballot's committed to do that, and we services here, we continue to evaluate what we can offer, what we maybe offer new. We have a few things on the horizon that we are looking at. Maybe, and then we've added a few new services here, such as OT, occupational therapy. That's something we've not had lately, and bringing a few things like that in on the outpatient realm and access is some of the things we really want to try to do.
I know that healthcare, it's always evolving.
Yeah.
The needs of the community are always evolving. What do you see now as the biggest needs in this community?
The biggest needs.
Yeah, for
So
healthcare.
So you know, in our whole region, we suffer from many chronic disease processes, and you know, whether it be from cardiovascular disease, pulmonary disease, and that kind of thing. We want to try to be able to strive to be able to provide primary care services for them to be able to get in, see their physicians, and then follow up and have appropriate follow-up care and access to that as well. Some of the other things that we do struggle with, and we've, you know, our behavioral health team has really worked hard at, is access to psychiatric care. So behavioral health and psychiatric care is really important in a struggle across the nation as well. That system's really tough, but we've come a long ways in being able to provide better care to those patients. So.
Okay, all right. Well, I didn't really have any hardball questions for you, or you know, just keep it light. But is there anything that you want to talk about as far as, you know, what your goals are, what you'd like to see achieved here?
I would say, like I said, is maintaining that access point here locally, because you know, a lot of people in our community don't have access to get to the larger hospitals or areas. As far as transportation, we see as an issue, and you know, that kind of thing. So being able to provide that locally is important, and to their overall health and care, and access to that's number one, and having it available. So being able to continue to provide accessible care in our community hospital here locally, and evaluating things that we can bring in that are needs for our community is probably one of the biggest goals that I have. Sarah and I grew up right beside each other.
Really?
There's pictures of us when we were itty bitty, we were looking at the other day. We grew up, I guess we lived there 5 years or so to get beside each other.
Here in town?
Yeah, here in town. So we grew up beside each other, and then she's now our director and works hand in hand with me now. So
yeah.
So we've never seen that coming.
Were you guys working together before you became administrator?
Well, she was a ER nurse with me here. She also started as a tech here, and kind of was a little homegrown nurse here as well too. Right. So and she did move off for a little while and come back. So that's one thing you'll see about a lot in this hospital and at Hancock too, is many of us have worked here and went somewhere else and came back. And it's a testament to how we are as a family here. So and Sarah is one, you know, Sarah's well known in the community too. She's committed to this community. I mean, hands down, one of the best partners to work with.
Bring her in here.
So you know, we've definitely been through a lot here, and it's, you know, the community through COVID. It was such a struggle, and we lost so many people here, and in the community that passed away. So seeing that, and just seeing that really made a lot of people realize, you know, hey, what we're in it for. Yeah. And that was important.
Were you shocked when you found out that he was going to be your new administrator, or did you see it coming, or how'd that hit you?
Yeah, go ahead.
I mean, I think we had a pretty good plan in place already for a succession plan. So I was glad to know that he was going to be our new administrator.
Yeah. So do you know him probably better than anybody in this building? Tell me, what are his skeletons? What does he have? What's he trying to hide?
Really, he isn't trying to hide anything. Yeah. He's very if you need to know what he's thinking, he'll just tell you. Yeah. He doesn't really hide much. No, we don't have a lot of secrets around here. So.
Yeah, I was just being funny. Yeah. All right. Well, what would you like to say about this experience working together and, you know, growing up together and then ending up?
Yeah, I don't think either one of us really ever thought that we would have the opportunity to serve our community in these roles. Yeah. But Hunter's 4 years younger than I am, so I don't remember when he was brought home from the hospital, but I remember when his sister was brought home from the hospital, and we stood out in front of their house with the big stork and a picture of her and us, and I think we have some really bad Halloween costume pictures that we could probably provide. Yeah. But, you know, Hunter and I think have the same thought of our community, and we want it to be here for our community because we want to serve our community. We're very big on that. You know, I have grown up here my whole life, but I did move away. But I was very excited to know that there was a position open that I was able to return home. And, you know, it's nice to be able to have a great working relationship with each other. So not only working, but outside of work too. Our families are together a lot. Yeah. So, yeah.
Do you guys still live beside each other, or just
no?
Is your family
No,
still?
we don't live near each other.
My parents still live in the same house, but they've moved. They have moved.